Camera action. All right, we're live. Hey, what's up, Rob? Thanks for joining us live here at the Bolera. Say hey, Rob. Say hey to the family. Hey. This is our bowling instructor. He came to give lessons.
Oh, wow.
Oh, really? Okay.
Oh, that's good.
You got a hook. You look like you got a hook. I do. Yeah. You go stick that hook out for me.
Well, his mom was involved, so he said he knows I'm long. Oh, God. Oh, really? Oh.
Four-finger bowling ball. Let's see what strictly this way. I'm on the hand. I will take this ball and feed the chicken. Good question. All but your picture. It's 4 holes here, but only 3 fingers. No. That's an extra hole for weight. For what? For weight. Yeah? Oh, okay. I put on 4 fingers. Can I do that? No. That's not cheating, is it? That's not cheating.
So he is
You hold the ball in your hand. It's pretty heavy. Some people put their fingers in the hole. They just hold the ball. Oh, man. Tell me more about it. Actually, let me come to fly. That's the lady with all the information. Come on, so weird.
originally downloading our like to see
As you can see, we're here learning how to use the app. If you haven't already done so, download the Mighty Networks app. Go to your app store and download Mighty Networks, and then find the Wellness Awareness Recovery Network. That's us. And we wish you were here, but we'll put some more information in the community. And once you join, we'll make sure that you get the information on how to navigate in the app so that you can have some fun with the rest of us. Because we're doing a really great thing on Mondays, Tuesdays, Thursdays, and Fridays in the morning at 9 a.m. sharp. There's a low impact workout that you can join us for 30 minutes. We do it to house music, so it's a lot of fun. There's also some yoga classes, some qigong classes. There's a qigong class on Tuesday evenings at 6:30 and Wednesday morning at 10 o'clock in the morning. And there's so much more. There's recovery meetings and lots more to come. And you don't want to miss it. So come on, join us in the Mighty Networks at the Wellness Awareness Recovery Network. We'll see you there. All right? Come on, hang out. You're on. Stand up in front of the green screen and respond to those questions that are on the card.
we didn't try to do that. Just too close to this.
What do you know about these? You know where you know about yourself. Networking with each other. No. It's for everybody. All you can say. That's not true. That's true. It is true. So, I could be something I would say. So measure HIV by copies of blood. And regularly people have T cell counts 750 or more. But the virus will take up so much energy that it will cause your T cells to drop. The T cells will not be measured in your immune system. Okay, well, I'm pretty much what I'm trying to say. You got the HIV. I was just trying to explain the difference between HIV and AIDS. Okay. AIDS person has HIV and they're undetectable, meaning that you can't measure, you can't see it in the system, you measure, so how do you know they have it? You know, it would have been detected at one point, but with medication, it can be suppressed. When your virus is suppressed, you can't treat it. That's the key. That's why I'm looking. It happened. I'm HIV. I was diagnosed. I was diagnosed in 1988. Although it's been up and down, but once they came out with medication, because there wasn't medication, it's suppressed now. And it's below a point where they can actually see. When I go get tested and they can't see it, you do. That's the way people do. Stay behind the high desk and then so we're gonna find you one day, we're gonna pick your ass out. Until then, you just stay where you at. Yeah. And the rest. Right. Glad you can make it. Come on through.
Good to see you.
My wife Vio and everybody. Right there, we go on there. Hello.
Hello, how you doing?
It's my pro legal crew, pro bono legal.
Yeah, we took classes the last 3 months. Oh, you're fine.
Hey, how you doing? Good. Carmel's in the house.
Oh, I just supported her thing. She just, they're like a not-talkative as websites and stuff.
I was just explaining to the public.
And I have my own not-talkative, but I want to support her to do some perfect. Yeah. Yeah. Hi. Oh, we're totally new. Like, I'm just. Okay.
There you go.
Oh, we can sit over there. So good. Oh, this is at a table. Sorry. Thanks.
Nice meeting you.
Same. So I can see what I'm doing here. Sorry.
Yes, you want to
Oh, my glasses though. I don't know if she's going to sell them maybe.
Oh,
Okay.
go to your house. Yeah.
you
Love the camera. Yeah, we nominated you. We nominated you. You're gonna be the spokesperson. All in favor for Tracy, say aye. Aye. All opposed? All abstained? All right, folks start to come through. Hey. All right. Folks coming through. How y'all doing? Come on in. Come on in.
What did he say when he said it the other time? I just want to understand. Right.
Good, Rob. What do you need? I don't know what. Oh, yeah, that's what we're going to play. U equals U means that if you're HIV positive, okay, and your virus is suppressed. Okay, that part I understood. For you? Okay, straight up means if you find somebody that's positive and they take a medication that their virus is suppressed, you don't have to worry about patient's virus. Okay.
What's up, baby?
No, I understand what you're saying. I want to know.
Okay, you gonna roll? All right. Wow.
I'm confused by now.
No. So the idea is that we want to end the epidemic in our community. So the more people know about how to stop the transmission, the better off we'll be.
We were talking the other day, and what I explained to you has nothing to do with this aspect.
Right. There's the recovery aspect as well. I mean, because when people getting high, they're liable to do. They don't pay attention.
Okay, we understand.
Right. They don't have information.
Right.
So it's really about helping other folks, especially young folks, straight brothers, to understand. Hey, yo, it's cool to be straight. It's cool to not be high.
Cool to not be high. Okay, I got that part.
Right. It's cool. There's a group of us that are doing that and staying well at the same time. Now we're talking about the health. That's the health we're talking
That's what I was talking about. Right.
So in our community, we talk about a lot of different things. You know, we have webinars around aromatherapy, around food preparation, around exercise. We have a Qigong class. And so it's a way for us to connect around wellness issues and recovery issues. We've got meetings where you can link directly to meetings in our meeting. You know, right there from the community. So it's something different. It's a social network, but it's not Facebook. It's not, it's not all over the place with a lot of wild stuff. It's focused on the stuff that's, we believe, will help our community. Of which you are a part of.
It's almost like,
Especially,
when you look at all the negative influences that we're subject to, whether it's how we treat one another socially, how we treat our bodies, take care of our bodies. It's like we're trying to address all the different aspects of negative impacts and influences that we have on everyday life. On this platform, so whether it's recovery, whether it's HIV, whether it's eating better, whether it's healthy. Meanwhile, I'm not.
and that's our solution. I just want to sit back and listen for a moment to see if I can grasp it. I mean, I'm trying to grasp it, but I do. I want to sit back and listen. I'm looking at the recovery from shut up.
So, really? Where is it? February? Summertime. July, August? August what? 3rd? 12th? So,
She said that she didn't like to know who you be. What your points from 7 to 7.
Leo and Scorpio.
Let me see your phone.
November 11th.
Help us. First of all, I don't know what you did. Right? Let me go. Let's see how you got it. How did you get over? See, okay. So fine.
Oh, yeah.
Oh, you got 4 10-year-old. We can get advice from that. stuff. Yeah, because we've been through it. Transformation. You saw the transformation. It's right here. Well, you looked at it just now. Of course you did. And you know, life is like that. Life is like that. So you can't, the minute you say you can't find something, that's exactly what you do. Oh, do I need to sign it? Oh, sorry. No, I need to sign it.
I mean, it's good. I mean, it's cool. But I'll be around to it. That's what I'm trying to meet the young people. Because Bonnie's local. Oh! We'll see how big it is. Yeah, see, in time. In time, look what's in time. Really?
The one you were just talking about.
In time. Benjamin Button in time. In time. The amount of time that you had in your life is on your arm.
I just saw it. I just had to go. I never seen it.
Yeah.
I have seen it. I just don't see it.
In time.
N-I-N? Oh, man. That was just so remember. I don't remember that meaning. But I was out to.
Y'all looking at it.
There's something pretty cool to be out
Yeah.
Marvin Gaye, Marvin Rest.
Right, yeah. Marvin Gaye. Yeah.
Oh,
Still messed up 30 years later.
And I was
Very true. But as far as it's not that I want to get to the age. How can I stay like I wouldn't mind staying between 40%? Because of the wisdom that I've been able to achieve and to be able to have a guidance to, you know, because as you get older, you can't control what you want. So that would kind of be my thing. I definitely wouldn't want to be right. I like that. So, be more secure and all that. That's what I did. I was talking about how you have what to do with network. So I'm going what y'all doing? What y'all doing? Yeah.
okay, he's like, oh, he's like, yes, it's like, I can live in a social network. I was on the okay. We can make it whatever we want. Now, listen to that. You know the I went to a woman's meeting.
Very sad. Very sad. Welcome to he said my name is my name.
They already got to know when you're ready. And I sat there. They kept on. I went to all women's open.
Yes.
Why? Why? Because I need to be. You said, oh, yeah, all right. Trying to jack. I said, no.
what do you want?
So you're on the screen.
But
No, I called Tony. Tony.
town, right?
What did you?
I'm
That's
born.
what I thought. No, I'm looking at my bedroom.
30 years, I'm into that.
Well, I saw you standing there.
I was about to take pictures.
Oh, that's a blessed phone.
Welcome, go ahead.
Yes. I'll get my guy back in this.
You know, I can't be over here as long with you. Your husband will get jealous.
Yeah.
Reggie,
Yes, ma'am.
Go over here along together.
What time to hand me off?
Well, what I like to do is download the
I
app.
like that. I like
Whatever.
Bring up the phone.
And it'll be
Make sure
so
that you got it.
I want my booth back.
what's the app?
It is the Mighty Network.
Download Mighty Networks.
So the reason we got together was so that everyone would be oriented to the application, so that we can all join in the community and stay connected. So that we can share some healing solutions. So see that lady right back there? She is 95 years old. That lady right there. That lady sitting right there with the glasses. So she's 95 years old.
What's the app, Reggie?
It's Mighty Network.
Mighty Networks? Is it for food service? Oh, she got me already.
My point is,
Is it Mighty Networks app?
Yes.
It comes right up.
And then when you get in there, find the Wellness Awareness Recovery Network.
Oh, I see it. Is that blue ember with an M? It's blue?
Yeah, that's Mighty Network. Yeah.
This is about Mighty is where it's hospital brand.
download that.
I wanted some of the sauce.
Hey.
How are you?
You're in there, yeah, you're already in.
Okay.
Hey, Maria.
I seen y'all over here. I knew I was gonna make my way here. I go at this. How are you?
Yeah, right.
Oh, this house is been there. How you doing? Good to see you again, right?
Hey, baby. No, I was telling you, I said, I can make those jokes about this. Yeah, yeah. When I said, my wife,
Yeah. I didn't know.
It's like a and then I go to the hospital, and then me and
She,
I got
she
you.
told me about that. She
I'll
paid
put
me.
it
All right, so can I have your attention just for a little bit? Yeah. First of all, thank you everybody for coming out. Hey, you two in the back. Especially you. I want to thank everybody for coming out, right? So the reason why we came out is because we wanted to introduce ourselves as the Reginald Dion Smith Foundation. I'm Reginald, and that's my wife. We are an organization that is providing wellness, awareness, and recovery to Black men and women, basically in metropolitan Atlanta, southern counties in Georgia, and the rest of the world, via the app. The application that we want to make sure that everybody can plug into is a way for us to stay connected around wellness, awareness, and recovery. A lot of us have different organizations that are doing it and different skills of our own. Like Adrian, by the way. Adrian, tell us a little bit about some of the stuff that you do and the stuff that your kids are doing.
Well, my daughter has a studio located at the Road Studio and I'm less than a minute. 1 hour workout class for power and so forth. I'm a certified yoga teacher, certified meditation teacher, and I do health and wellness groups on Monday night for the domestic violence organization called WAR. We all matter. That's some of the stuff that I'm doing. And I'm hosting some of the events that I'll be presenting.
Studio on TV recently, like
Was
her studio on TV recently?
Yes.
That was awesome. I saw that coverage. I like it. Yeah, that's great.
They go on the Tamron Hall show, they go on Fox News, and they can teach you to jump in this.
I saw that. That was pretty awesome.
Yes, yes.
You can introduce yourself.
My name is Maria Manning. My organization is called Magenta Moms Inc. I started it because I'm a special needs mom, and mental health is a very big issue for everyone, but especially for special needs moms, it's kind of a different lane. And I opened the nonprofit to help other women through with their mental health needs, caring for their children. Our children don't leave us most of the time. We have them from under 1 to 100. So a lot of the techniques I've been teaching my moms focus on meditation and breathing. That's the one tool we always have with us at all times. And so that's kind of my focus right now. I also do other things, products, services, counseling, all those things we're building up for the moms. But the one basic thing that we always have is breathing. So that's the one thing I keep pushing with my moms about, meditation and breathing.
And appreciate you too. See,
Okay.
So we're networking. Hermione, Coach B.
Hello, everyone. My name is Hermione Bell. I'm a nurse practitioner by trade, and I have my own practice as a primary care provider. I specialize in HIV care as well as gender affirming care. I also work with a nonprofit called the Heather Ivy Society. This is a support network for women living with HIV. Cisgender Black women living with HIV. So I do a lot out in the community to spread awareness. I educate so you can take care. Not telling my patients, because it's not just me telling the patient what to do. It's facilitate how healthy you want to be.
And that's what we're doing. So, everybody's doing something around wellness. And wellness is the thing that brings us all together. I always like to say, when you're sick, the only thing that you want is not money. You don't want a whole lot. The only thing you want to be is well. And if you have access to information, access to a network, or to people that are sharing healing solutions all the time, and it's easy to do. It's like I've been living a vegan lifestyle for 30-some odd years, but I fall off all the time. I fall off. I get sick and stuff like that. I forget stuff. You remember this stuff that our parents told us that I forgot about. But if I'm in a community of people that share that kind of information, I'm more likely to remember it when the time comes. Or to be able to share it with someone else. So, if you like me, I got tired of Facebook, of all of the riffraff and the yah-yah on Facebook. So we created our own, that's when we got hit with the Mighty Network and said, okay, let's start our own thing. And this is what we've come up with. And so far, we've got almost 400 people in the network. And that's without even really trying. And that's without people really even knowing how to use the app. So we said, what do people need to do? They need to know how to use the app. So let's start coming together and this is the core. This is the core now. When y'all learn how to use the app and we start using it together, then invite your friends in. Our intention is to get to 500 before long. And, you know, we get ready to start a Facebook campaign where we'll start. That's why we're going to shoot some footage on today so that we can be positively representing ourselves in the social media, in the social atmosphere, with positive messages around wellness, awareness, and recovery. And then we will invite people into our private network and share those healing solutions and do our own thing on the side. It's a private community, so they can't shut us down. Unless they shut down the internet or Mighty Networks, we're good to go. We don't have to worry about Zuckerberg or anybody else. And we can create whatever we want. If you have something in mind that you want to create, like Dion came up with, she wanted to do a low impact workout session in the morning. We've been doing that low impact thing now for over a year, 4 days a week. And I don't want to get up in the morning sometimes. And I wouldn't get up in the morning sometimes, except for the fact that there's other people that are there expecting us. We do it to house music. We do it to music just like we do it now. And so it's a lot of fun, and now we're committed to each other, and it's a good thing. I'm playing softball again. Don't tell disability. I'm sorry.
No, you can pass. It's softball.
Yeah, I don't care, because the bottom line is that it's a real dichotomy in our minds. So our outreach coordinator is blind. He's down in South, and I just traveled with him to Dallas, Texas. Blind is just an amazing experience to have him around to see how he negotiates. But he asked me a very important question. He said, do I consider myself to be disabled? And I had to stop and think about it. I was like, not disabled. But yeah, you know, I'm HIV positive. I'm getting a disability check and have been for almost 20 years, but still work hard not to think of myself as being disabled.
Right.
Because we want to be well.
Right.
And I want to participate in my own wellness. But you know, you got to play both sides
And
of
the
the
contract
business.
stuff, yes.
And so, but the body and the cells only know what you tell them.
Right.
So if I keep telling myself I'm disabled, I'm gonna be disabled. But I got to tell myself I'm well, but still at the same time, you know. So it's so we have our own community, and we're reinforcing the fact that we're well, that we can be as well as we want. I plan on living to be 200. And like I said, that's why I didn't pick 85 or 90 or anything like that. Because the reason why we think about dying is because we don't want to be sick, you know.
Right. Yeah.
So if I don't think that I may not live to be 200, but if I plan to live to be 200, then at least I'll be well as long as I can.
Yeah.
Right. And that's what we want. Now, another motivation for what we do is that I got sick and tired of watching all of our friends and family die or get sick, you know, as a result of our lifestyle,
Yeah.
which is something that we can change. You know, it's something that we can be aware of, if nothing else. So that's why when we were talking about, I was so impressed because, you know, wellness is a common topic. So this is not about HIV because a lot of people get, you know, that's what I found out very early on about HIV. It's not about HIV, it's about being well. You know, they may never hit us with the cure. Everybody talking about Magic Johnson got the cure. Magic ain't got no damn cure. And even if he did, what the cure Magic got is that he's staying well.
Yeah.
The cure is staying. Cure is a word, and what cure means, okay, the virus may be gone, but I will take the healing. Being healed means that I'm well.
Yeah.
I'm doing well. And so we want everybody. There's a lot of different things that are going on out in the world. What brings you here?
Well, I'm here to support you. I'm here with you.
Glad to have everybody making the ways in the house. I see a lot of folks coming through over and making the way.
Yes,
What's
we
the-
serve a marginalized communities, chronically homeless, those affected or infected with HIV or AIDS, mental health issues, and substance abuse issues. I've been there almost 12 years, worked there for the last 5, although I am technically disabled. I get that check. I also get get support elsewhere. But I was diagnosed back in 1989.
Wow.
So I've had it a long while. Well, actually, I wasn't diagnosed back then. I found out through having testing done that I had it since 1989. But I am undetectable, as we talked about one of the U's in the U for you. But it is a life, and I see one of the biggest things that I get to see, unfortunately, is there are so many stigmas put with so many issues. Whether it's being HIV positive, being gay, anything. If you don't fit in, if people don't fit into what they want you to fit into, you've got a stigma. And then they want to develop that around you and to avoid you like the plague. Vegans, sorry, you're a stigma. I don't want, I cannot picture myself eating all vegetables. I like vegetables, don't get me wrong, but I like my protein. I'm sorry, I want my chicken, I want my beef, I want those things. I can't picture my life without it. But again, I'm still curious as to how it's done and how if they're satisfied with that lifestyle. So it's, it is interesting to me, and it will become a learning experience.
So like one of the major terminologies now is harm reduction. So when we came around, recovery was hit because that's recovery from drugs and alcohol was achieved mostly successfully through the 12-step program. But now people are finding that not everyone gets 12-step recovery. So sometimes they need a way to smooth their way out. Like when you try to quit smoking cigarettes and you pick up a little chew stick, that's behavior modification. You can do that for a while. So, it's really about sharing healing solutions with each other. There's no judgment. Like I said, it's really about being human beings and loving each other. And that would stop a whole lot of stuff in terms of stigma. Stigma is being more afraid of what other people think about you than you are what you think about yourself. And that's great. We're not going to do that. So we're really glad that you came out. We hope that you learn. We want to make sure that you understand how to use the application before you leave. We want to thank you already for signing the media release. And we got a few questions that we want everybody to answer so that we kind of gauge what you know about U equals U, about PrEP. Do you know about PrEP at all? I'll give you a little primer on it. PrEP is pre-exposure prophylaxis. Prophylaxis means to protect you from something. And pre-exposure prophylaxis, so they're using the HIV meds to keep us as a way to be like a vaccine, not a vaccine, but keep you from contracting the virus. So if you were to have sex with someone and you didn't know what their status was, then you would have a better chance of not catching the virus. So there's a way to protect yourself now, so that we want to end this. We want to end the epidemic. So if some people now, the thing that people say is, I don't take the medication because you know about Tuskegee, and that's how they did us. But I'm telling you that the medication won't kill you. Yeah. But HIV, you'd rather live without HIV than have it. Yeah. So you just need to know about PrEP so you can make an informed decision. Now they got not only the medications, the pill medications, but there's shots. I personally, even with the virus, have taken the shots once a month. Some people taking it twice in a month. Soon it'll be once every 6 months. Matter of fact, they have once every 6 months PrEP shot for women. Am I correct?
No, not quite yet.
Okay.
That's still in clinical trial.
Okay.
But currently, for PrEP for women, you have to take an oral tablet on Truvada, and that's generic also, or you can get the shot, which is called Apretude. You take one shot every 2 months.
And see, Heather Ivy is one of our partners, and they're performing. They're doing the clinical trial.
Yes, we are doing a study called the Ebony study, And Ebony is for cisgender and transgender women of color who are at risk for acquiring HIV. And the study is looking at implementing PrEP use in Black women. As far as PrEP use in the country, 90% of those people who are at risk for acquiring HIV and who are on PrEP are white gay men. For the number of HIV infections, it's about 35,000 infections a year, and 60% of those who acquire HIV are Black people.
So are any of these protocols covered by insurance?
So yes, these medications are covered by insurance. However, there are some loopholes or hurdles you have to go through sometimes to get them from certain insurance companies. But there are free programs. If you are uninsured or underinsured, you can get the medication for free.
Okay.
It's when you have insurance that the problem comes in. So I am one of those advocates that talk to pharmaceutical companies as well as insurers, because it makes no sense that a person who is uninsured can get the medication and someone who has insurance has trouble.
So is that access guaranteed at the federal level for the underinsured and uninsured, or is it state by state?
So it is on the federal level. CDC has a program called Ready, Set, Prep. All you need is a prescription from your doctor or healthcare provider, and you can get the medication. However, being on that medication is for people who are not living with HIV, so who have a negative HIV test. And so you have to be tested every time you come in to get the injection, or every 3 months if you're on oral medication. And within that, you have to have an HIV test done and then check your liver and your kidney function. And so those things are not covered if you're uninsured. And so then you have to come out of pocket to pay for those. And it would be criminal to keep prescribing someone PrEP and not test to see if they are actually living with the virus. And so there are guidelines from the federal government. The U.S. Prevention Services Task Force has an A rating for providing PrEP for anyone, and that should be covered by someone's insurance. All costs covered by insurance. But there was just a law passed, or a judge, I should say, blocked a provision of the Affordable Care Act, and because he felt that providing PrEP for all, because someone's promiscuous, and you're providing for gay people, and that's something that he didn't believe in because that's his religious belief. So why are you going to put your personal beliefs on someone else's right to prevent acquiring HIV? So there's a lot of fights going on, at several levels. And I want to thank Reggie and Dion for this platform to where we can bring some of those voices and people can hear what's actually going on. Because I can write prescriptions and do the follow-up and all that, but we really need to have access to the whole program and not just the medication.
See, I love the way God orchestrates a good movie, because as he started talking about the political aspect, our board member, Diana Brooks, just walked in. What's going on, Diana?
Yeah.
She's sitting by the door within the Gold Dome. What's really going on?
I have a question. Thank you for the information. I just recently heard that the state of North Carolina, their legislator, on a bipartisan basis, voted to expand Medicaid.
Yes.
Which, my question is, in the state of Georgia, they have their own version of the expansion of Medicaid. I don't even know if you want to call it that. They got their own version. Would that give greater access to people if that version of Medicaid were available to the masses?
So the proposed Medicaid expansion only is for a certain number of people and who have specific illnesses, HIV being one, and then there are some other ones, but it's only for a short period of time, and you have to, there's a lot of loopholes, a lot of things you have to do. If they had expanded Medicaid without having these kind of restrictions, they would serve 600,000. So with the one that they are proposing that seems to have some momentum, it's only going to cover about less than 100,000. So,
Oh, is that right?
yes. Because you have to think about, there are other programs that can assist people living with HIV who are underinsured or uninsured, and so they rely on those. And so those people who are in the gap that might have a little bit more income and don't fall into the category, but still qualify for Medicaid, those are the ones who are going to be special Medicaid.
So, just pick that in the, finished. With the little special expansion, is that somehow tied into the mental health bill that was passed? And is there a creative way to piggyback onto the mental health bill? Because there's a lot of funding going in that direction, which I know includes HIV and among other areas. But is there a way to piggyback on that for the care? See, because you go in through the front door and only get 100,000, but you come out the back door, you got $1 million. You know what I'm saying? It's an ongoing conversation. It doesn't end with the okay, this is what you get.
Well, I do know that there are agencies and nonprofits that are working toward that. Like, I work closely with Georgia Equality, and Jeff Brand is one of the executive directors for Georgia Equality. Does age watch and goes, to the legislature all the time. And so, yes, there is going to be there is still some talk. And I guess another way that you can go around the system is going to allow. And so it hasn't been, I guess, put to bed exactly. And so there's still some.
Thank you.
You mentioned Medicare, is that also on the Medicare?
So Medicare is a federal program. Medicaid is also federal, but it's administered by the states. So Medicare, so it's just like when you go to the doctor and no doctor really can not say they're not going to be able to take Medicare, but they can refuse to take Medicaid.
I got you.
And so, it just depends on what state you're in, because some states, Medicaid works phenomenal. But, here in the South, we're very
Excuse me. So I see the Are there certain medications that are targeted towards certain audiences, and why is that?
So, Descovy is a combination of two medications called tenofovir, alfuroate, and then emtricitabine. And so, Descovy is only for, it's not prescribed for women, cisgender women, or someone born with a vagina. And the reason why is because they don't have enough data to show that it is effective in women. And so that's why they use the previous form of Truvada, of Descovy, which is called Truvada, which is tenofovir disulfiramate. Don't get me set up. You did good. And then emtricitabine. So TAF, and we use initials. TAF is a new formulation that's in Descovy, and TDF is in Truvada. And so when you see that commercial on TV, that's why they say not for female, not for persons assigned female at birth,
right?
Because of absorption, they don't have data on that. So that's the only reason. And so then, but there's a generic form of that. And so when they changed the formulation of Descovy, from Truvada to Descovy, it was to make it safer for kidneys and bone. And so then women are more at risk for bone problems as we get older. I mean, everybody loses bone, as we age, but some women are more at risk for developing osteoporosis, that kind of thing. And then people living with HIV are more at risk for requirements of being able to get osteoporosis also. So then when you're using this formulation in women, because you don't have the data in which to use Descovy in women, then you're doing this disservice to the public, my opinion. And so, as far as research and that kind of thing, the other thing is that a lot of these studies are done in people that don't look like us. The majority of the studies that got these medications approved by the FDA, 70 to 80% of them are men, and white men. And so a little fraction of all other ethnicities in the studies. But then once it comes to the general public, you hear about this, not this many side effects, this, that, and the other thing. And then when you start using women or other people of color, that kind of thing, then you start seeing side effects that you didn't see in the clinical trials. Because in clinical trials, they were testing the drug. you have other comorbid conditions like diabetes, high blood pressure, whatever, take other medication, they don't want those people in the study. It's gonna make their medicine look bad. But then in the real world, those people are taking up medicine. So you have to, so, I've done research too, and I'm doing research, like I said, I'm working with the evidence studies. But I mean, we need to have more people that look like us, and then also in study as well as those doing the study. Because a lot of these study protocols are developed by people who don't look like us, and they already had their agenda set. So we have to be more
Proactive.
yes.
We had to be real active and start hitting the ground running. And we found out through COVID that we can stay connected. All of a sudden, in the past, I tried to engage people in digital, but people didn't want to be bothered. But now everybody knows at least how to get on Zoom. So what we're showing you now is how to use this app so that we can be in our own space, so that we can continue these conversations, because we have to galvanize and get data. So we're starting to get some support because now we've really built the capacity of our organization. Our organization was formed in 2012, but we started watching TV just like y'all. We see these commercials, and the commercials are all focused on gay white men, just gay guys, nothing but and peace to that, because there's a need, but there's also a need in our community as well. And nobody was really speaking to heterosexuals, and so that's what we're doing. And so we really appreciate your support. And we also understand, because we've been in the game for a long time, that stigma is a big deal for everybody. So we don't even have to speak directly to HIV all the time. The main thing about HIV is wellness for everybody. Everybody, I mean, and the disability thing brings us all together. And we're gonna need those numbers, if we want to make some moves. And people need to be informed. And when you can see, we've got informed people. We've got people on the streets, people in the game that know what's going on. So we just need to be able to share that information. Because if you don't know, I want to say, you know what you know. You know what you know. You know what you don't know. What you don't know. What you don't know. And if we come together and start sharing information, put this app in the high kid and invite the folks that you know need to be in there. Kick what you're doing in there as well, and we will be better for it.
So, Reggie, I know the focus is not limited to that. That's been the focus area. Where does Hep C fall into the focus area for this platform?
Oh, Hep C is a health issue, and so it falls in. Everything falls in. Lupus, everything falls in. There's nothing that doesn't fall in.
So diabetes, chronic kidney disease,
everything, because how we eat, what we drink, what we put on our skins, makes all the difference in the world. No matter what you get diagnosed with, because there's stuff out there that's gonna catch us anyway. If it catch you slipping, it's gonna get you. I just got off a shingles. I just got off a shingles run. Right. I don't even like taking shots. The virus shot. Bet my ass is going down there to get that other shingles shot. You know why? Because that commercial right there, that don't knock. Shingles don't get him. Shingles don't get a damn. And I got off easy. I caught it in the body.
Oh, wow.
If it kicks you in the face, that ain't a good look. Hep C, I was diagnosed with Hep C the same time they diagnosed me with AIDS. But they said, don't worry about the Hep C because that's a long time thing and the AIDS will kill you. But the AIDS didn't kill me. But I stuck around long enough for the cure for Hep C. But some people won't take the cure because Tuskegee, because the man trying to kill us. And I'm not saying that he's not. But I'm just saying we got to be informed. you got to make good choices. You got to make good. If your ass is on fire, where's the water? Like in recovery, some people don't want to make an AA meeting, don't want to make an OA meeting, don't want to make this A meeting because I'm stuck on this. You're stuck on stupid. If you need, if you can share with somebody. So in the app, once again, we can share the way we want it. There's no police, and we can make it what we want. If you've got an issue, if you've got a healing solution, and you can share it and we can blow it up. And we can grow the community to millions. we can blow Facebook out the water. And you know what? They want to give us the money. They want to give us the money. Thank God for your support. They want to give us the money because they know nobody's doing it. So now's a good time. That's why we have an alliance with a number of different organizations. I just went through a session with Pro Bono Legal. God is in this. God is all up in this. And so, we just want to.
Well, I just want to piggyback off your comments about vaccines. Anyway, we had all this hoopla about the COVID vaccines, that kind of thing, but it's real important that when you go to your healthcare provider and know when you need certain vaccines. So at the age of 50, people should be getting the shingles vaccine. At the age of 60, you should be getting the pneumonia vaccine. Each of those things are adult immunizations. And when you mentioned hepatitis, there are 3 types of hepatitis. Only one is curable. Hepatitis A you get from contaminated food or water, bad food poisoning, something like that. Typically does not lead to long-term liver disease, but it can kill you. It can be, you get that acute type of hepatitis A and you can be dead. Hepatitis B can be chronic. You can get it and you can clear it, or it can stay with you for life, and there is no cure for that. And you have to monitor for years and years and years to decrease your risk of developing cancer of the liver. And then there's a cure for hepatitis C. So it's really important, when you go to your doctor, this is the other thing I tell my patients, it's like prepare for it like you prepare for anything else that you do. Have your questions written out, because they're only going to give you 15 minutes, if that. Because usually you're waiting about an hour before they get in, right? And then they come in all fast and hurry and say, okay, you need some refills, you need this, and they have not answered any of your questions because they got time. So it's your time, make the most of it.
What about lung screening?
Lung screenings?
So that's something that they don't want.
Yeah, sometimes, that's one of those things in which is not reimbursable, so to speak. And it's not one of those things that are in the, like Healthy People 2020 or 2030. So there's certain things that, the government or insurance, they look at those guidelines that are put out by, our federal agencies, and those things are covered by insurance. So that's why people don't necessarily do them. If you are a smoker or if you have some history of COPD or some kind of lung problem, yes. But if you don't have a diagnosis, they're not going to do it.
But they also have grants for those type of services.
But, the other thing is that you have to be aware of them. Right. Because it's like I've worked with private doctors, Ryan White clinics that get federal money. And in this private doctor's office, this patient told me one day he lost his job, so he's going to lose his insurance. And so he was like, he didn't know what he was going to do. I said, well, do you know about Ryan White? And he was like, no, what is that? So this is, the program that provides services for people who are living with HIV and who are underinsured or uninsured. And so I told him about it. He was able to get his insurance covered by a program called HICP, which is Health Insurance Continuation Program. And this is part of the federal Ryan White Act that pays for meds and pays for insurance for people living with HIV. And so he was able to stay with his doctor and have the same insurance, and that's covered. And so, but his doctor didn't know that. The patient didn't know that. So he was good. So the previous times that patients have lost their insurance, the doctor was like, I'll see you when you get your insurance. Mm-hmm. And it's like, so that person thought out of care for however many years that he didn't have insurance and didn't know about the programs that were available. And I think that's a disservice that his doctor did to him. So, I'm advocating for programs, medical, nursing, whatever schooling people get to be healthcare professionals, that they teach about HIV and some of these disparities beyond just the health conditions, but social disparities of health that keep people out of here.
So it's getting crazy out here in these streets, right? You're coming up with all kinds of legislation that's affecting all of us, especially babies, especially our women in the whole nine. So we really need to stick together and keep each other informed. That's why I think God created the wellness piece, the awareness piece, so that we stay aware of what's going on. And the recovery piece. And the recovery piece is not just drugs. It's really about those things that we become addicted to that don't serve us, like sugar. Oh, did that hurt?
It hurt.
You know, and all cigarette smoking, you know, just all those things.
It's like body and
It is
body
not.
and being. So to that point, like I know right now the focus has been in the Atlanta metro area for a lot of the recruitment to the platform. But tell us a little bit about the demographics right now on the platform as far as like what states people are getting involved in, if there's anything happening outside the United States, what are the plans to maybe have that happen?
Yeah. So right now the concentration is basically in Georgia, but we do have people from all over the country, and we just recently traveled to Ghana, so we have people from Ghana, and we intend to set up. Well, Ghana is already set up. I'm serving on the board of an organization, a nonprofit in Ghana, so they're like our sister city, and quite frankly, you know, Marcus Garvey said we might all be on that.
All right.
Be on that Black Star. You know, we got a little land over there already. No, this is really, you know, I was at little Malcolm in me, you know, Malcolm and Martin. Nigga Martin over there, he laying in the cut. Martin, you want to say something? All right. So we really have to, you know, stick together. And the imagery is really important. What we see is what we believe in most instances. And we can create those images. We can create the communities to be whatever we want it to be. So it's not like we know what we're doing. I mean, we have a sense, we have a vision, but the vision collectively can expand. And this is the core. We are the core. So yeah, it's worldwide. You know, take it to another planet.
One question I got.
Go ahead.
The question about the app. So it's a wellness community. So in putting other wellness things that are going on, like Queen of Four's moving here.
Yeah.
She's got a place here because I'm a sacred sister.
Okay.
And quite a other non-holistic places that I visit that I'm involved with. That would be information that you would like to be put in the app?
Yes. We want people to know what's going on. Not only in the events section, which I will show you. Look on your apps, please. And you'll see the little hamburger in the top left-hand corner. I just realized that that's what they call that, a hamburger.
With the megaphone?
If you look on the screen, let's see. Baby, pass me my glasses. I can't see it. My glasses. Okay, you see in the menu? First, let's click on events. Click on events. You see the bowl of learn on top for the name. You see all the different meetings. You see the morning meditation at 7 a.m. That's really cool. You see conscious contact. If you have a group, let us know. That's meeting virtually. We'll put it in. You know, we can even, you see, Dee, this is the big deal right here. Dee Dee's low impact workout. Y'all been missing it because we do this to house music. Like I'm a DJ and we do it to my mixes and other people's mixes.
So Reggie,
Yes.
what if someone wants to start a meeting? I know there's a young lady that I work closely with who is very interested in starting similar to a recovery meeting, but it's for trauma, unrelated to any specific type of trauma, but a trauma meeting.
Yes.
Or there is a safe community for people in which people can share. And would they contact you and ask if they can start that on this network?
Yes, absolutely. Like, so the question was, if someone wanted to start this, friend of Diana wants to start a trauma meeting, not specific trauma, but trauma in general. If it's virtual, we can host it. I mean, we don't not host it. They can set it up Zoom or whatever, and we'll post it in the events. and make people aware of it.
So,
Okay, fabulous.
my question to my sister was, is there a fee for an organization that would want to become a member or have their program on that?
No, there's no fee at this time. Now, there's an opportunity for us going forward. What we want to do is remain independent.
Yeah.
Okay.
So there may come a time when grant money doesn't come in, and we want to keep running. And we're building up staff now. One of the reasons why we didn't grow before, because I wouldn't take on the staff, because that means you have to take on the responsibility knowing you're gonna pay somebody.
Right.
That means you gotta be working to get money, and I'm retired. I ain't trying to do that. Matter of fact, it's another 5 years, but I can see this growing into a multi-million-dollar operation, and then somebody else taking over. The idea is to get it going.
Right.
So there's an opportunity for us to have a membership, a fee-based membership, and also to do events, fundraisers, where we can split revenue so they can keep the functions going. But as of right now, no, we're looking to have as much content, positive content as possible.
So any event, just put it in there so people know about the events.
Exactly.
Okay. And
You know,
if something
just-
I want to do, I put it in there too.
Exactly.
So
Especially if
you
it's
don't have to
something.
be an admin to add it.
No, you can post. Let me check that. But you can post it in the feeds. You can post it in the feeds. Now, if you post it in the feeds, let me know, and I'll put it in the events if you don't have access. Or I can make you a moderator.
But there is a plus sign there.
Right. The plus sign. Go ahead, hit the plus sign.
Yeah, so I,
Because you can't break it.
right, I know. So you hit it, and I guess there's another menu.
Okay.
another strategy.
Let's take a look at
So
that.
it's kind of like an Eventbrite.
Right. Right.
Right.
It's like a lot of things.
Yeah. Because I have another organization I'm with, they under it too, and they came up first.
Oh, yeah, they can, you can. this
Oh
is
yeah,
what it
there's
is.
there's
This
other
is
mo-
the
there's
add it.
plenty of.
That's how you add it, and it even gives you a category.
Okay, now which?
So I
Where'd you
went,
go from there?
so in the events,
Uh-huh.
there's a plus in a round circle, and if you hit that, then it brings up categories. So whatever you wanna post for, let's say wellness, so to press wellness, then you can do either, maybe you wanna,
Oh, community
Copy an
inspiration,
article
video
or-
recovery.
Right. and or you can do a quick post, it says you can ask a question.
Oh, so if you do a wellness and you quick, go ahead.
There's all kinds of stuff here that you can do, I guess we would have to
Thank you
go
very
there and
much.
play with it.
Thank you very much. Like you said, you can hit that on the top. It's a drop down, and so you'll have an opportunity to post.
With, oh, this is perfect, Reggie.
This is
really
And it
nice.
has your name so that I could, oh, this is nice, see how the Reggie.
And you can create.
My daughter was just telling me I didn't have enough people on Instagram to do all this stuff, and now I can do it through here. And they have another one called Fan Base now.
Bro, we can create a channel for your daughter
Okay.
Reggie
on the
posted
walls.
their double dutch.
Yeah.
Posted that in here. It's
Oh,
in
you posted
here.
it?
If you send me flyers, I'm posting it.
Oh, yeah, so I'm sure on YouTube. Okay, nice. They do a certification weekend and everything. Nice. And what about other stuff like girls just want to have fun?
All of that. You
They
can
have
write.
something today.
You can write an article.
Now I lost it, I gotta figure out where I
Quick
was.
post. Quick post.
It's bad.
And the application is improving as we go along. So like right now, you can only post one picture at a time. I don't like that. But they post it, they're going to change that.
So let me go back. I was-
Also, we're very much, we have very much,
Oh, it's a plus. You see it in wellness? Yeah.
we very much want to make sure and advocate for the disabled, physically disabled, the blind and the deaf, to make sure that everything is accessible in what we do. That's on our side. So, there's just so much that we can do. We can create channels for topics, but we want to keep it as simple as possible. So everything will be under those three categories: wellness, awareness, and recovery.
Right.
Videos, live. We're live right now. We're streaming live.
Reggie Smith or Wellness, whatever, is going live. Because I'm part of something else that you're in live.
Right.
And so I always see it.
You're on this, but you did not have the app.
That must be.
Right.
Yes.
That's what it
So
was.
now that you have the app, it's easily accessible. I would say move down to the front.
Yeah, because that's how I came on your exercise.
Who's that?
A couple times.
Yes.
She does.
So it won't matter, and it won't matter where you're at, and it won't matter if and when everything gets shut down.
Wow.
No, I'm sorry, I'm just playing. We ain't gonna shut it down.
Please don't tell me.
You also remember like, no, don't do it.
I told you they had each other. A
Yeah.
lot of kids are just one kids, yeah. They're able to
Like
each
some
other.
of them by herself.
Oh, yeah, it's hard.
She was great. She was in the room. She was on Roblox.
Oh, that's them. That's them. They're the Roblox community.
Build a whole new world. So I know that you know,
The next time you do your smoothie challenge thing, you can post it, and we can do it together.
exactly.
Whatever else put it on there. That
I'm
makes
like,
everybody
yeah.
I'm starting.
Right, right.
So we know.
Let us
Put it
know.
on the calendar, right, so we know.
So let's have starting a little blog.
Yes,
I can put my blog on it.
you absolutely can. You can write an article there anytime you get ready.
Okay.
We'll start following it.
Yeah.
We're
Exactly.
gonna get you, listen, we're gonna get you more than 500, and that's one of the things I do. That's our promote, so.
And the other thing that will be awesome is to see us following each other. So this is what I'd like for you to do right now. Before you leave here, make sure you're following everybody that's in this room.
That's good.
So like, go to members.
Okay.
Are we gonna do it on your thing, not on
Okay,
Instagram?
go to members, you said?
Okay, so it's on.
Okay, go to
Oh,
the
yeah, I
hamburger,
see that, I see it.
Go where?
the hamburger on the top left hand side.
Okay.
And I would show you on this, but this is different.
And then how do you?
Go to members, go to members.
Let's see, click on the name.
Click on the name.
Yeah, you can.
And then say program. Okay.
Where's members?
So,
I don't know.
So,
Sorry, so is it advertised section?
No, it's
no,
not.
it doesn't look like it.
It's not advertised, but I just want to okay, so we
everybody in
follow.
the room and whoever else.
Follow.
Matter of fact, don't stop there, follow some other folks.
I'm following everybody.
Everybody needs to follow. I'll tell you one person everybody needs to follow. Follow Althea L. Follow Althea L. Althea L.
She's at the top.
And Dr.
And Dr. William Richardson.
Out there, L, follow her.
Follow Althea.
Yeah.
Follow William
I'm
Richardson.
already following.
Althea, every second and fourth Thursday at 2:30, Althea's live. And the recordings are in the community now. So
Dion's an admin.
go and check out the screen. If anyone would like to become a moderator, feel free.
What does that entail?
Just gives you more access.
Access to do what?
I don't know.
To post?
Find out. Let's play it again.
So Riri Manning, is that you?
That's me.
Yeah,
Yeah, what's your name?
So listen, their last name is Manning, so I daughter.
You with me, Rob? You with me, Rob? I'm gonna need you to take it back to the front. I don't know. Do it, I can do
Where's
it.
Tracy? Tracy, where are you on here?
She's in there, so
Tracy.
Yes,
I'm
I'm down there. Tracy Core member.
okay, here's what else you can do. If you're looking for a specific name, being that it's not in alphabetical order, scroll to the top and
And
search.
just type the name in. Say.
Oh, and then you search. Oh, so let me find everybody's name.
Yes. Yeah, where's the search?
Can they give us a follow? There should be a magnifying glass at the top right. All the way to the top.
It's at the bottom.
Right.
Okay, look at something, search right here.
Well, I started to, then I said, this is gonna be a little too much.
I probably should have all, like, follow all.
Good question.
Right.
If you have questions about things that they should change in the app, holla at me. I'll holler at you.
Ariana, Bell?
Yes, okay.
Oh, it does come right up. You put it right here. Yeah, I see.
How we doing, Bird? Doing good. We doing good. Mike, we all right? Because ultimately,
Anybody else name on this?
we still want to get you all in front of the green screen because, thank you once again, the content that you share will help us not only to get a better understanding of what you know, but it also help us to get some money. Some more. You
question.
I have a question, and I apologize for being late. If the question was already answered.
Hold on 1 second, please.
Ask her who she works with.
She said to ask you who you work with.
My name is Meeks,
Hey, Lisa.
but it's something else.
What's
My government name.
your government name is?
I don't know everybody. I ain't always been a good girl.
Come on, sis.
But, in terms of, everything you guys have talked about thus far in terms of insurance, what happens if you're a veteran? Is that a double dipping thing if you try to, get services from the VA and then services from,
Oh, I'm gonna say no to that,
No.
because I'm a vet. I go to both places. That veterans can double dip. They can go to private insurance, private carriers.
They can't do nothing about her.
Yeah.
You're entitled to that.
It's just like when you get money from the VA. It's tax free. You don't even count it.
right, but however, you can't get one source from the VA and then try to, just say for an example, if a veteran is getting non-service connection pension, veteran can't get Social Security. It has to balance out. Let's just say it's $1,000 for the VA, and then let's just say Social Security is $800. Then you're only going to get like $200 from the VA. The rest.
Really?
So, yeah, you can't double dip like that. It's two
Did you know that, honey?
I didn't know that. I didn't know that.
It's two government entities. That's why I was asking.
That's a
if you
new
double dip.
development though, because for a long time.
I did not know
they-
that.
Say that again?
There's some questions around eligibility as far as vets, whether or not you can do that and get other government funds as well. But I think the bottom line is that these are great conversations that we can have
Oh, yeah.
inside the community and find information and share with
She
you.
works with vets.
Oh,
Distract.
that's right. Please.
Miss Brooks.
Yeah.
But Nisa, you work for the VA,
I do.
so maybe you can share some of that information inside the community. That way we will be aware.
Absolutely.
We can follow up on that. We
Absolutely.
may even create, things will formulate as the demand.
Absolutely. Diana was asking the difference. Non-service connection and service connection. Service connection, you can get it all. You
Okay,
get everything that's due to you.
that's the good news.
That's the good news. Bad news, if you get non-service connections, that's where you gotta have to check. If you meet this qualification.
That ain't gotta do with me. Everything happened to
That
me.
doesn't do me.
Yeah, everything happened to me was because of them.
Exactly,
They did it.
exactly.
And it's reparations time. For reparations.
And Deborah, what do you do?
Yeah.
My name is Deborah,
Hey,
and,
Deborah.
I currently work at Grady
You know about
Hospital.
Fulton County has already started reparations and task force reparations.
Excuse
You don't know
me.
about that?
Excuse me.
County has already started.
Call, teacher, call.
Oh, Deborah was
Where's the Grady?
Yes, I work at Grady Hospital and I work for United Healthcare. I am licensed social worker.
Ah, all right.
No, you don't.
Wow.
All right. And yes, so the Reginald and Dion Smith Foundation, which, this is all under the auspices of, I guess as we grow, we'll be able to plug into all of the different resources that are available. When people we have a friend that's in North Carolina whose daughter was having some mental health issues. So we use right now, or beginning to learn how to use Unite Us, which is a repository of resources that are available generally in Georgia. But we will be creating that same type of network of resources within ourselves, so that we can refer to somebody, because if you got kids, something will happen. If you have parents, someone's already happened. So,
Reparations, I would love.
reparations.
I heard reparations.
Reparations, I'm like,
I said, I couldn't even hear.
You're like Dion. I said, Dion got Tourette's. Y'all know she got Tourette's.
Don't say that. Cancel.
Yes, all right. All right, so is there was something else? Oh, the app. How we looking at the app? Does everybody have much better grasp?
Reggie, could you use your phone and kind of do a demonstration so that we're sure everybody know where to go and what to do? Because
Talking about you, right?
yeah.
Oh, thank you very much. All right. Check it out. So the question was, is there a way to refer other people inside the app? So here's the hit. Do the @ sign and somebody's name. Do the @ sign and start. Like right now, put @ and in the comment. And then you could also, we can create chat groups of up to 9 inside the chat. You can create chat groups of up to 9, but if you're commenting or if you see a post that you think someone else should see, in the comments, put the @ put Adam. Don't get Adam.
Okay.
Meaning for those uninitiated, put the @ sign and begin to write their name.
Hey, Joe, what's your last name? Walker?
And then it will start to pop up. We can create chat groups, which I haven't really used a lot of, but we can use more of. You can chat with someone individually, just you and them inside the chat group, or you can click on their name and chat with them directly. Create groups and chat. Check and see if you can go live.
Let's see. Live coming from.
Right.
Marietta.
That would be amazing. People just start going live. Hey, I'm live. And I know that we can do live groups more than once.
Live where? Live right here?
Oh, no, that's live, meaning that it's live right now. That there's something going on. If you see that live, that means that there's an event or something going on live inside the So you'll see, go into wellness. Click on the feed.
Wellness, we got four.
DC, you in there?
So on top, look and see. Generally on top, you see the feed, you see chat, events, and discovery. Right.
I don't see live.
But
Okay.
you're live right now, so does that mean?
Is that why?
Click on
3 dots. Click on the 3 dots.
Oh, the 3 dots, go ahead, click on the 3 dots. Details, invite, personal settings, and then cancel.
No. Not everyone has that access.
Because y'all are admins.
Right, access. Right. That might be a little too wild. Might get a little
A little too wild.
What are you doing?
I'm in Publix right now.
Publix is an easy one. I'm live. I'm at the crib. I'm in the bedroom. Oh no! Turn down the music. We don't want that. So what else? Because the more that we are, at least now we have, you can get around.
Yeah. I like this.
I gotta tell them, they gotta have you in their studio doing something.
No, they don't. Yeah, they don't. I don't even have to be there. All they have to do is come into the community, turn on the camera. I can give them access. They can turn on, be on Zoom.
Did they do a live every Wednesday night at 8 o'clock? So they No.
That can be on Zoom, Instagram, streaming.
Okay.
That can be on almost video.
Okay.
Doesn't matter.
No.
Oh, I'll be on that.
Not just someone who's on this station, so I was gonna say.
And she still came on and did the show on Thursday. This is amazing. You'll see some of the recordings that we did in the past shows. She did aromatherapy, blocking out. Another young lady. She came on and she talked about her focus. Go look at me.
He said you pull down on your knees.
Nisi, what's your problem? Been over here yet tonight? So have you been over here?
Are we done, Reggie?
Did you come over here? I don't know. I got it.
And Reggie, are we done? We got people live. Are we done? Right.
So we've been live. You can see what's going on. We'll record it. We'll do some more, but we're gonna break out now and start doing some other things. We're so glad that you can join us. Watching from a recording. Go back and watch the whole thing. You'll learn a lot about not only the kind of people that are in the community, but you'll learn more about the app so that you'll be able to join us. We appreciate you. We love you. We'll see you next time. Until next time, on the other side, say peace and blessings.
Learn something.
Oh, yeah, they got both sides. Oh, they look like softball.
So once it's done,